Diabetes, as we all know, is a disease which is most prevalent in this part of the world, and India is considered to be the capital of diabetes by the year 2025. Diabetes is basically of two types, type 1 and type 2. Type 1 diabetes is the one where the insulin is not being secreted, and it usually occurs in the younger age group. Say type 2 diabetes is called as maturity onset diabetes, which develops later in the life beyond the age of 35, and it usually has an underlying family history of diabetes or due to other risk factors like hypertension, like obesity, like dietary dietary habits, and like excessive intake of carbohydrates. So, in such patients, diet plays a very important control to diabetes. As we all know that obesity leads to insulin resistance and it adds to the problem of diabetes. So, for those who are having poor diet control, they should switch on to a diet which should be low in carbohydrates. Carbohydrate rich foods are basically the cereals, that is the rice, wheat, and the flour. So avoid taking too much of chapatis, rice, and things made of maida. Secondly, is all cold drinks and all fruit juices. They contain a lot of sugar content in them. They must be avoided in such patients so as to control the diabetes. Thirdly, the patient should be on low carbohydrate diet, and the vegetables which contain more of carbohydrates or have a high glycemic index like rice, potatoes, they must be avoided. Along with that, the patient must walk for at least 45 minutes, at least 5 days in a week, and it has to be a brisk walk so as to control his diabetes. Without dietary modifications, diabetes cannot be controlled at its own alone. This is a message for you all.